Lung cancer kills thousands of people every year. The American Cancer Society says it is the second most common cancer in both men and women, and it is by far the leading cause of cancer death in the U.S. Although people often link it to smoking, the founders of the White Ribbon Project say looking at this disease as if it only has one cause is a barrier to diagnosing people because anyone with lungs can get lung cancer.
Heidi and Pierre from the White Ribbon Project are joining us this morning. We appreciate y'all being here. This is so important.
Thank you.
Thank you.
Yeah, thank you for making the time. Okay, tell us about the White Ribbon Project and how y'all started this.
Yeah, the White Ribbon Project is a small, nonprofit, grassroots organization, and our primary mission is to promote lung cancer awareness. We'd like to say anyone with lungs can get lung cancer. No one deserves it.
Yeah, and being a lifelong health enthusiast, health educator, and a fitness trainer, married to a primary care physician, my family and I were blindsided by my stage 3A inoperable lung cancer diagnosis in October of 2018. What was really scary about this was I had no symptoms, and this was an incidental finding while investigating another health issue. I was initially told I only had 4 to 6 months to live, but a new immunotherapy had just been FDA approved about a month prior to my diagnosis. So after I endured chemo and radiation for 3 cycles, I had immunotherapy infusions for 1 year, and I'm standing here today, proof of concept, almost 7 years out, that research matters.
Yes, research matters and screening matters.
Yes.
I know that is a big part of your mission as well. Talk about screening because so many people are eligible for screening, but they don't get screened.
Yeah, absolutely. There's over 16 million Americans who are now eligible for lung cancer screening. Primarily, you have to be 50 to 80 years old with a heavy history of tobacco use. So I encourage those people to talk to their physicians about whether or not they're eligible, because in Colorado, less than 10% of people are screened, and nationally, we're maybe at 16%.
Wow.
Well, and you know, one thing that we were talking about earlier that I want to put an emphasis on right now is, yes, if you smoke, there is a chance that you could get this, but those are not the only people at risk of this. And I think people who don't smoke, you're kind of fooling yourself and you're not protecting yourself as well as you could.
Absolutely. There's other risk factors for lung cancer. You know, it's estimated somewhere between 10 to 15% of people who get diagnosed with lung cancer don't have a history of tobacco use. Radon, Colorado, over 50% of the homes in Colorado have elevated radon levels, and it's the first leading cause of lung cancer in people without a history of tobacco use. So while many people, or most people who don't have a history of tobacco use don't qualify for screening, they definitely should not consider themselves immune, and should they have any symptoms, coughing up blood, unwanted weight loss, other symptoms, they should notify their doctor. I'm concerned.
Yes, it must drive you crazy as a survivor of lung cancer when you hear people say, well, I wasn't a smoker, I don't have tobacco use, so, you know, it won't affect me. Clearly, that is not the truth.
It's not the truth, and it used to irritate me until I put on my health educator cap and realized this is a teachable moment. Yeah. People in the general population knew the same thing I did, that if you didn't smoke, this wouldn't happen to you, because that's what we've heard from institutional messaging. But when I first got diagnosed, I thought I was an anomaly, but I'm not. When Pierre says 10 to 15%, actually it's climbing to 20% of people without a smoking history. Let's translate that to a number. It's about 250,000 people every year that get diagnosed with lung cancer. Wow. So 10, 15, 20%. We're climbing up to about 50,000 diagnoses a year unrelated to tobacco use.
Right.
Yeah.
My goodness, yeah.
And we don't want to victim blame. I mean, people, tobacco use is an addiction. As a physician, all the patients that I had that used tobacco, they wanted to quit. They just couldn't, so.
But Pierre and Heidi, y'all have me thinking about, you know, when should I get screened? What is eligibility to get screened, and at what point in my life and our lives should we start considering that?
Well, currently the guidelines for most insurances to pay for it is that you have to be between the ages of 50 to 80, and you've had to have a history of heavy tobacco use, and gets something to be, you have to smoke the equivalent of 1 pack a day for at least 20 years, and you have to have quit less than within 15 years. So for people who don't meet those qualifications, there may be some, we're promoting more research for other tests, blood tests perhaps, that may be available in the future. But right now it's really pay attention to your symptoms, particularly any respiratory symptoms, particularly coughing up blood, unwanted weight loss. Talk to your doctor.
Yeah.
We're running out of time, but I do want you to talk a little bit about these and how people can get involved with the White Ribbon Project.
Yes, so this was literally my scream to the world when I got frustrated that the information isn't out there. And I asked Pierre to make me a big white ribbon out of wood that I can put on the front door and at least let my neighborhood know that I had lung cancer, not ashamed of it, and need to talk about it. One picture went viral on social media, and this became a global movement. This weekend, tomorrow, from 10 to 3 p.m. at our home in Greenwood Village, we are hosting a ribbon build, and people can come and help us paint these for distribution at the World Lung Cancer Conference in Barcelona this September, and to people, survivors and caregivers throughout this country. So it's a unique opportunity to help us out with this, painting them, labeling them. Children are welcome. And I know, as a team, everybody getting together to get the word out, we will save lives.
Absolutely, absolutely. You're so inspirational, Heidi. Thank you so much for sharing your story, and Pierre, for your knowledge. We appreciate
Thank you both.
both of what you're doing. Thank you so much.
Incredible.
Thank
yes,
you.
Thank you so much.